Not every CO-50 denial means the service is non-covered. Some of them are caused by the wrong diagnosis. In this scenario, the service is covered by the plan, but the diagnosis linked to it is incorrect. Common examples include labs billed with screening diagnoses, EKGs linked to preventive visits, and tests without medical necessity diagnoses. The payer reads the claim as screening or preventive instead of medically necessary. For example, if you bill CPT 30300, removing a foreign object from the nose, but you link it to headache, R51, the insurance computer will deny it as CO-50. Why? Because a headache is not a medical reason to perform nasal surgery. The computer thinks you made a mistake. To fix this, you cannot just guess. You must check the LCD, Local Coverage Determination, or NCD, National Coverage Determination. Every CPT code has a specific list of approved diagnoses that Medicare will accept. Go to the CMS website or your coding software, look up the CPT, and find the Group 1 codes. In our example, you will see that foreign body and nostril, T17.1, is on the list, but headache is not. Once you find the correct diagnosis in the medical notes, you don't need to appeal. You need to submit a corrected claim. Go to box 24E, the diagnosis pointer. Change the pointer so the procedure links to the covered diagnosis, T17.1, not the symptom, headache. Resubmit the claim with the correct linkage, and it will get paid. But be careful, never add a diagnosis just to get paid. It must be in the doctor's notes. That's it for the part 2 of the CO-50 video. Thanks for watching. Next up in part 3, we talk about the trickiest one, preventive versus diagnostic testing.